Hello, welcome back. This video is to help radiologic technology students understand the distribution of barium and gas in the stomach during an upper GI exam. So the first thing we need to do is look at the stomach and how it lies in our body. So the most superior part of our stomach is the fundus. And as you can see, the fundus lies more posteriorly in our body than the body portion and the pyloric portion of our stomach. So I like to think of it as the fundus lies closer to our spine and the body and pylorus lie closer to our umbilicus or our belly button. So let's look at this picture of our patient that's lying supine on the table with an AP projection. Now, this picture above her is the way that her stomach is situated right now in a supine position. So we're looking at esophagus here, fundus of the stomach, body, and then pyloric portion of the stomach. This is the large intestines and the rectum. So I've positioned this anatomy in a supine position so that we can see that if the stomach had liquid in it, such as barium, that liquid would be settling in the fundus part of the stomach. And then gas would rise up toward the body and pyloric portion of the stomach. So the barium would gravitate toward the fundus with the patient in a supine position, because you can imagine her fundus is closer to her spine back here, closer to the table, whereas her pylorus and body of the stomach are lying up towards her belly button, which would, the air or gas would rise up toward the body and the pyloric portion of the stomach. So looking at the image just below her, you can see the barium is collected in the fundus of the stomach here, and then the body and the pyloric portion are filled with gas. Now, this patient on the other side is in a prone position with a PA projection of the beam. So I flipped the anatomy to be in a prone position. So here we're seeing the esophagus leading into the fundus, which is closer to the patient's spine, which would be here because their belly is down here. Their pylorus and body of the stomach would be lying closer to the umbilicus, the belly button. So we would have the body and the pylorus closer to the table here, and the fundus lying up towards the patient's back. So the air or gas would rise up into the fundus of the stomach, and the barium would settle down towards the belly button into the body and the pyloric portion of the stomach. So looking at this image, we can see the fundus here. It's radiolucent, filled with gas, and then the body and the pyloric portion of the stomach filled with the barium, patient in a prone position. Now, one more thing I wanted to look at is how we can tell if the patient is rotated or not. Because these positions, the patient is supposed to be positioned flat on the table. The interiliac line should be parallel to the table. So in order to look at our x-ray and see that the patient was not rotated, we would go to the spine. So we can find the vertebral bodies here and see the vertebral bodies stacked on each other. And then we can find that spinous process in the center of the vertebral body. We can also see the ribs coming off of the vertebral bodies laterally, and those are pretty much equidistant. They're symmetrical. There are the right and left pedicles here on the vertebral body. Those should be equidistant from the lateral borders of the vertebral body and symmetrical. And those spinous processes down the center. So we can go to the next x-ray here and do the same thing. We can find a vertebral body here. We can find spinous processes centered down the vertebral bodies. We can see the ribs coming off of the vertebral bodies laterally. We can find those pedicles equidistant on each vertebra, the right and left pedicles. So we can see that these patients were positioned without any rotation. I hope that this was helpful. Thank you for watching.